The paper we're diving into today is titled Molecular Changes in the Invasive Front of Oral Cancer by Mohit Sharma, Parul Shah, Sonal Soy Sharma, and Raghu Radhakrishnan, right? And it's published in the Journal of Oral and Maxillofacial Pathology. So it's very much in that intersection of clinical practice and basic science. I have to say, from the title alone, you wouldn't guess how much is going on at just the very edge of an oral tumor. Yeah, that invasive front is really the paper's core focus. And the big question it's asking and trying to answer is, why are traditional clinical staging systems like TNM not actually that great at predicting how an oral squamous cell carcinoma is going to behave? Like, you can have two tumors the same size, same basic location, but they can act totally differently. Exactly. That's significant because treatment decisions, such as whether someone should have aggressive surgery or chemo, are based on those staging systems. But, as the paper points out, the actual biology at the invasive margin, the front where the tumor is actively pushing into healthy tissue, turns out to be a lot more telling. The authors review a long list of molecular changes that happen at that invasive front, and honestly, it's a pretty wild ecosystem there. They dig into how certain molecules like laminin 5, fibronectin, tenascin are either lost or gained. These changes loosen the glue that holds cells together, allowing the most aggressive cancer cells to break away and invade. Laminins especially are super interesting. Normally, they help glue cells snugly in place. But at that invasive front, some versions like laminin 5 are actually enhanced, which seems counterintuitive. But as the authors explain, that makes it easier for tumor cells to latch on to the new territory they're invading, almost like laying their own carpet as they go. And then there's the whole side of enzymes, proteases like the MMPs, which basically chew up the extracellular matrix, letting the tumor burrow further. The authors point out that the highest activity of these enzymes is found at the invasive front, not in the middle of the tumor. I love that the paper also talks about markers like E-cadherin and syndesin 1. If those disappear at the invasive edge, it's basically a sign the cells are getting ready to move out. It's kind of like they're unbuckling their seat belts before jumping into traffic. Yeah, and the authors suggest that by studying those molecular changes specifically at the invasive front, clinicians might eventually be able to predict which tumors are more likely to metastasize. So it would be like personalizing a patient's treatment based not only on the size of their tumor, but on its molecular attitude, so to speak. It's a subtle shift, but if you think about it, it's sort of like, okay, this is a weird analogy, but like not judging a book by its cover, but by how fast the pages are turning right at the edge while someone's reading it. Well, I realize that doesn't totally make sense, but I see where you're going. It's about catching the action where it's happening, not just looking at the static picture. Exactly. And the paper underscores that academic research is about building that more nuanced picture rather than delivering absolute answers. Like, no one molecule is going to be the golden ticket. It's a whole panel and pattern of changes. So for listeners, the key takeaway is that cancer's behavior depends not just on what it looks like under a microscope or its size, but on what's happening in these dynamic molecular level conversations at its edges. And one day, those insights might mean better, more tailored cancer care. Absolutely. And I mean, the more we can appreciate that it's a moving target, the better decisions we can make. Even if sometimes the science feels like you need a translator and a map just to follow along. Yeah, but that's what we're here for.